30, and I see from the gallery facing me we have a quorum of members. So I'll call the meeting of the Board of Health to order. Good evening, Cheryl. Would it be possible for you or either Dave to put the agenda up on the screen?
Yep, I'm going to give this a shot tonight, and Matt is helping me with the public. So when we're ready to take public comment, we can ask him.
All right, that would be excellent. So I see the first thing is an update from you, and that makes sense because things continue to change on a fairly rapid basis. I know our president has extended the shelter-in-place suggestion, advisory, whatever, until now I believe it's the end of April. So that perhaps is cascaded into changes with the state level. Appreciate any update you could offer us.
Yeah, we are looking for guidance tonight to, see, but it's on the agenda, so we can wait. But we will be looking for guidance to have the board direct us if we should follow that same guidance that public buildings should be closed until the 30th, or indefinite, whatever the board would like to vote, or at least until the public health emergency's been lifted or something like that. But we can talk about that when we get to the agenda item. We have been busy doing frequently, essential businesses. We are constantly being bombarded this week with people or businesses claiming they're essential. We finally did get some guidance on the state website under frequently asked questions, where they answered some of our questions that we've been having. So one being the bike shop is considered essential now if they do repairs. So that answered our question for pedal power. We also had car wash detail claiming that they are cleaning cars and therefore they were essential, but the guidance there says no. So we'll reach out to them tomorrow. Some of the other ones I don't really think I've talked to you about, but like a pool company, chiropractors. So now that we have this guidance, it's making it much easier for me and my staff. The other thing I have is the construction order that we voted last meeting. We're looking for some guidance from you on that. It's kind of written that it may be read as a policy, not an order, but we do use the word order in the policy. So I just need some clarification from the board on that. If it is an order, it does conflict with the state's, with the governor's policy, which I guess is being hashed out between the towns that have already they've created more regs on top. I think we quoted them last week. I think it was like Cambridge and Somerville. So I'm looking. I definitely need some guidance on that tonight if we can. And that's. Oh, and the other guidance I'm looking for would be if we're hearing some recommendations that we should. How we're doing our daily updates, and we're talking on those updates about confirmed cases, and we just want guidance from the board that to if you still want us to continue those updates with the numbers.
Okay, thank you, Cheryl. I was particularly curious, was there any further guidance from the state regarding, shelter-in-place orders or advisories?
I haven't seen any new advisories. Not from the governor. I mean, I listened to the governor's press conference today, and it was more stuff that, pertains to like, telehealth and stuff like that, but nothing that pertains to my department.
Okay, because if I remember correctly, the current advisory from the state expires April 6th. Is that my recollection correct?
Yes. And I've had people question on that, and I have not seen a new updated guidance yet with a new date.
Okay, well, my guess is we'll probably see something, but may not be for a day or two. All right, well, thank you very much. Then let's dive into tonight's agenda. I see the first thing on the agenda is the Acton Nursing Service, or was there something ahead of that, Charles?
Oh, nursing service is up first.
Okay. Is Heather on the line?
Should be.
Hi there.
Good evening, Heather.
How are you?
Well, so far, I think we're all okay.
Okay, good.
How was the town?
Busy. Just a couple of updates. I'm sure that folks saw the total numbers for Massachusetts today have gone up by 700 odd positive cases. The governor did talk today that they did an additional, I think, 10,000 tests in the last 48 hours, which is amazing. In Middlesex County, we're still running the highest for all the towns of positive cases. We're doing a lot of conversations with the Department of Public Health on reporting and any contact cases or positive cases within town. And we've started doing some case tracking based on positive cases within town. And we've been getting a lot of calls, like Cheryl has been, a lot of people interested in why we're not telling them where these people are located, why we're not telling even the street or the part of town where there might be a positive case. And, unfortunately, as you know, or fortunately for the people that are positive, it's not information that can be shared. It is protected health information. So I just wanted to mention that tonight because we have gotten quite a few phone calls, especially today for some reason, as to why we can't share that information. I am working, sorry.
You may have said this and I missed it, but how many positive cases do we have in town?
4.
Okay.
Yeah.
And as of, what was
today.
It? Thursday, it was 1, right?
Correct.
Okay.
There's 4 that we're following. So other than that, we're doing a lot of contacts of positive cases or potential cases in town that we follow as a public health department to, monitor their symptoms, give them advice, answer their question, make sure they understand quarantine, all of those things that we do as public health nurses. John had reached out to Peter Light at the school department with a request that I had looking for assistance from the school nurses, which I believe we talked about last Thursday. So I've given them a sort of a draft outline of things we're looking for them to assist with. I think after we talk about the letter that will be going out and when it gets mailed, and as more cases and more contact tracing comes through, we'll need, a first set of people making contact, getting, basic information, and then myself and Linda Cullen and a couple of our other nurses within the office who have access to the Maven system will do the full follow-up with entering, all of the things that we're doing for monitoring, for documentation. So I think we need to get that set up. So we're working on it. I have an email from Dawn Bentley at the schools that I'm going to answer tonight, basically giving her, what I foresee as hours or staff that we may need. I definitely think we'll have to start at a lower level and then just reassess as every week goes by.
Okay. Hopefully we'll start to see some improvement. Unfortunately, we seem to be not yet at the peak.
Bill, I have a question for Heather. This is the other Bill.
Please go ahead.
Heather, I presume those 4 cases are under home isolation?
Correct.
Okay. I think it is fair that you can share that these are not people shopping at Idlewild or Roach Brother,
Right.
that they're at home.
Yeah, no, definitely. All of the cases that we are monitoring, whether they're positive or just a suspect case, they are all at home quarantined until particular dates have gone by, and we keep in touch with them.
Excellent.
Thank you. One related question to what Dr. Bill just asked, which is, how's Emerson Hospital coping? Are they saturated, approaching saturation, or doing okay?
I'll be honest, I don't know. I don't know the answer to that. I haven't heard any feedback from Emerson. I know last week we had gotten some calls from discharge planning departments about taking positive COVID cases, but I haven't heard anything since then.
Okay, thank you.
Bill, can I make a comment about Emerson or the hospitals?
Please.
There's been an announcement from CDC and Trump that they're establishing mandatory nationwide reporting by all the public and private labs that are doing testing for coronavirus for all 4,700 hospitals, which would include cases and those type of things, as well as supplies and bed capacity. So I would think those would be reported to CDC and then funneled back to individual state health agencies, and we'll hear from DPH on those.
Okay, that would be good. You didn't get an indication that they'll make that public. They're just collecting the info at this point.
They're collecting it without names, so there's no personal identifiers. It'll definitely get back to local and state health departments who have to do the follow-up.
Okay, thank you. Heather, any other comments for the board?
I don't think so. Thank you.
Quick couple questions, Bill.
Yep, fire away, Mark.
Heather, how many cases of quarantine and isolation are there currently, and what's the trend?
Hi. Hi. Can you hear me?
Yes, thank you.
Sure. So the number of quarantined, I believe, is at about 8 or 9 right now, but we've had a number come on and go off since this all started. With the lag time of the labs reporting or the Board of Health getting everything into Maven, sometimes what we're seeing is it'll be a week after someone has already been told to quarantine, either by the state or by their doctor's office. And the same is true with any international or kids coming back. No, I'm sorry, that's not true. International flights, within the last 2 weeks, all of those folks are they've gotten packets at the airport, they've gotten masks, and they've been told to quarantine.
Okay. Another question following up. I had sent this on to Cheryl, and hopefully you got it too, regarding Chapter 111, Section 109, talking about household reporting of person infected with a disease dangerous to the public health. Do you have any update on that, or you heard anything about it?
No, I haven't heard anything about that at all, to be honest, other than what you sent today.
Okay, because that could be very important, because if, it requires the local residents or all the communities to notify the local Board of Health if a person in the family or the house is known or diagnosed or reasonably believes. That would help in the case tracing and getting a better feel of the spread within the community.
It would, but I will be honest, there have been cases that we've been following for quarantine that were not, did not ever get symptoms, and we had, concerns that the family did not want to talk to us at all. So I think there's still that stigma, unfortunately, about communicable disease, that people are hesitant to share those facts.
Okay. Anything else, Mark?
No, I guess we want to try to tell folks that if they are providing that information, obviously it is confidential, HIPAA protect information, so there shouldn't be that reticence, hopefully.
Any other questions or comments from members of the board or the Board of Selectmen?
Yep, Mark, sorry, Bill, it's Mike. Just wondering, it's going to sound like a broken record, but Heather, do y'all have PPE and ANS?
I'm sorry, you went out a little bit. I only heard part of what you said. I apologize.
Sorry, do you have PPE for Acton Nursing Service?
So as of now, we did get a shipment of masks, but other than that, we do not have gowns and we do not have face shields. We of course have gloves.
Okay. Thank you. Anyone else? Any comments from members of the public or questions for Heather?
Just trying to figure this out, Bill. Give me 1 second. We have 2 hands raised.
Huh, okay.
Cheryl, I can't seem to unmute them. Matt, you have to be a co-host.
Oh, all right. Well, that's not going to work. Well, I can't see the panelists now, so I don't know.
Okay, Cheryl, Matt here. I'll hop in and grab those for you.
All right. Thanks, Matt.
First caller, your wife.
Hi, everybody. This is Tara calling from West Acton. I want to thank you for all your efforts. I have a couple of questions and then a comment. Relative to the case tracking and the Maven, where does the information go? Does it stay in Acton or is it shared with the state or other agencies?
So Tara, it's Heather. So under the guidelines and the regulations for communicable disease and the Maven system, I do not, and other boards of health do not need permission from a resident to share their information with another doctor or lab looking for information on their testing.
Thank you. And then you had mentioned addresses, or sharing addresses. I was just wondering how much information is shared.
No information is shared outside of a physician and myself. It's conversation.
Or the testing, or the testing labs, as you mentioned, other agencies, and it just sort of go on and on. What is the limit?
It's only medical personnel. The addresses and other information can't go to any other entity.
I see, because under HIPAA, there's a huge loophole at the end if you look at it, and the exception is all third-party affiliates and all this kind of stuff. So basically, HIPAA doesn't really protect us at all, just as a comment. And then the other thing is that
Tara, I'm going to comment on that. Communicable disease does not fall under HIPAA guidelines because of the need to share information between medical personnel for the spread.
Okay, then I guess we should probably stop saying that HIPAA is protecting people, even though it doesn't. There is no effective protection of our privacy data except for this, I don't know, oath or something, or regulation that says that they can't share it outside of medical professionals, because there's lots of groups that do data collection that call themselves medical groups, and they sign up and get registered as medical groups that get the data. But I do some work for that professionally during the day, and I can speak to you offline about that. But just anyway. Thank you for your care. And the other thing is that gowns are being sewed by groups around the state. And if you need gowns, I can put the word out and try and get you gowns, masks, I think they're showing gowns, masks, and kind of other things. I can't remember what.
Thank you.
Okay, is there another comment from member of the public, Matt?
We have two more in the queue. Oh, I'll mute the next one now.
Hi, this is Bettina Abe with Acton Conservation. How are you all tonight?
Like I said, so far we're doing fine. We're hoping to keep everyone that way.
Awesome, thank you. Just for Cheryl and Heather, I was contacted by the ACACS, the Acton Chinese American Civic Society, and they recently donated 800 surgical masks to our EMTs and firefighters, and they have about 100 to 150 more that they have to donate. Where would you like those? John Mangiarotti told me he thought the Acton Nursing Service could use them, but I didn't know if any other staff need them.
Heather,
Hi, Bettina, it's
yeah.
Heather. Yeah, we would appreciate those. Thank you.
Very good. I'll get them dropped off to you.
Thank you.
That's all. Thank you.
Thank you. Matt, last one.
Mr. Davidson, your wife?
Is there no one there?
I hit allow to talk and he disappeared. Hang on a second.
Can you hear me now?
Yes, we can hear you now. Please go ahead.
Okay, I am calling regarding a statement that I saw just a little while ago, and I'm quoting here, the Board of Health orders that all rail trails and conservation areas, including parking areas, are closed and residents should not be congregating at those locations. I'm a frequent hiker, as is my friends, my family. At this point, it's among the few things that we can look forward to, and it's an important source of exercise and fresh air. I don't see how social distancing would be incompatible with family or household groups hiking. It's just my perspective that this might be an overreaction to the current crisis. We're not mindless spring breakers. We're smart enough to get off the trail when we see an approaching hiker, give them distance, and some of us are even smart enough to turn our backs on the trail so we can breathe into the open woods for good measure. It's not like
Dickinson, I apologize. Let me just jump in. First of all, what you're reading is a proposed agenda item. It has not been adopted by the board. It's for
okay.
It's actually,
Thank you.
It's actually the next item on the agenda. So
Then I will hold my thoughts until then. I looked at the agenda and I didn't see it explicitly listed, so.
it's under affirmation of town field closure, which is the next item. And I would say I think we can probably get the sense of where you come down on that, but so.
Okay, well, I'll hold off the rest of my comments until the appropriate time, and apologies for the
No problem.
early fire.
No problem. So I believe that is actually time for us to move to the next agenda item unless members.
Can I ask a question to Heather?
Yes, please, Rika, go ahead.
Yeah, I was wondering, does Heather have any information on a patient or on an individual who was positive and then after quarantine turned negative?
Hi, it's Heather. No, I don't. Our positive cases are brand new, so we haven't gotten that far out in time.
Okay, thank you.
Rick, I apologize. My gallery on the side of the doesn't show everybody, and
No problem.
and it doesn't seem to.
I was just asking because like the studies are going on because the plasma of those individuals would have antibodies against the virus, and those can be, the plasma can be injected to patients. And in some cases, it is helping some patients in New York. So that's why I was asking.
Oh, okay.
So I haven't, oh, sorry, could I comment on that?
Oh, please go ahead.
Sorry, I apologize. I have seen that information. Thank you for passing that out to everyone. I have not seen it on our state level that they're doing that once patients have tested negative.
Yeah, no, I was just wondering if we could pass on that message so that anyone who was positive and then became negative, if they can donate blood, it can be used throughout the country, right?
Yes, that's what I have heard. Thank you. I appreciate that.
Thank you.
Okay, so let us move on to the next agenda item as sort of.
Can I ask one question, Bill?
Yes, please. Go ahead.
Two things. One, thank you very much, Heather. We really appreciate the update. One question that came up is we're having more cases in town. Some of them could be on the border with other communities. And you've heard of cases where, kids going next door and things. Do you have any communications with the surrounding towns if that would be the case and sharing of information?
So if we get information of a positive case that we do tracing on and there is a resident from another town, our job is to reach out to that town so that they can then follow that case that was a contact of a positive. And the same is true for towns, who are getting positive cases. Some of our contact cases with a positive are from other towns. That's how the tracing works.
All right, thank you.
Thank you.
Well, okay, like Mark said, Heather, once again, very much we appreciate your time and your insights. It's very valuable. We're very glad to have you as a resource.
My pleasure. Thank you.
So in that case, let's turn our attention to the next agenda item and has to do with the affirmation of town field closures. So I sort of mentioned Mr. Conaby prepared a draft order for the board's consideration. Probably would make sense, if it's okay with you, Mark, to have you speak to it.
Sure. I had talked to Cheryl, and backing up, there had been obviously a prior town decision and board order closing town buildings, which we need to address, and certain other facilities. And it came to light that there is a lot of significant non-compliance and problems at a number of sites, for kids going on the playgrounds, sports areas, Narrow Park being a parking lot completely full, groups congregating, and the question really comes up, what do you do? So in discussions about it, it seemed like a formal order that was effective would need to be drafted. Now, the order was drafted as strict as possible to elicit comments and public input. It was not designed to necessarily be something that we need to do today, but something we may have to do at some point if there is the continued non-compliance and issues, or God forbid, the expansion of this community outbreak. So talking with Cheryl about it, there's obviously the first step, which has already been instituted, is to close certain fields and play structures and certain activities, and those are problematic. So I think the next step would probably be to provide more information to the community, to try to provide more notice of the closures where it's more prominently displayed that they're closed and limited, so people are not engaging in inappropriate behavior and touching a lot of hard surfaces and things, that playground structures, picnic tables, handles, bathrooms, things in the public arena that are high means of transmission of the virus. So that is kind of where we're getting at. And I think this question about how best to do it, and certainly the most public way, the question is it an order? Is it a directive? Is it guidance? Is to draft it as a formal order so there is no question and it's clear and consistent. So I think based on that, the comments have really come up. How limited should it be? And what should be the breadth and scope and timing? As always, you want to try to protect the public health because it's the paramount. issue of the order. What I think we would like to see is less people engaging in that risky behavior and trying to provide a role in helping protect the health locally. So your option A, is to ramp up the provisions or go all the ways and close them. Now, as in everything, there are certain things you do want to do and certain things you must do. We must protect the public health, but we really don't want to craft any order that is more restrictive than necessary. Getting back, I think stepwise, I would suggest we consider, NARA is already closed, but we should be really explicit, except the designated walking path. And it should be more prominently displayed. Signs, barricades at the entrances, tape, cones, so it's clear. One suggestion of input was to put snow fencing or other barricades across the fields with a closed sign, same things at the parking areas. I think that's probably the other one that I would really suggest. The biggest risk is when you have large congregations. And certainly if you looked at the parking lots, and the pictures have been documented, that NARA parking lot was almost full through the nice days. And on Saturday, it was completely full. That really is not consistent with what everyone is trying to do. It's non-essential activities staying at home. Going out like it's a snow day or a vacation day or a group travel or walk or meeting up with folks is just not consistent with that. So I think probably we could take the next step and really ramp up the notices and the provisions of indication of closure, limit the number of parking spots to say 10 parking spots in these areas. So that way you would not have large groups being able to assemble. And it was also thought that since there's been a lot of problems on some of the other area like the playgrounds and fields, secure some of those areas that can, and maybe put some fences or other things so it's clearly visible that these aren't areas you're supposed to be going in. So that was the concept. The idea was really to try to help promote the discussion and draft something in a form based on this teleconference type atmosphere that's easier to discuss and provide more input. Hopefully that helps.
Okay, thank you, Mark. At this time, if I could, I'd like to ask Cheryl to just comment. I know you've had conversations with the recreation director and the town manager. Is there any steps that the town can do to, make it much more, I'll say obvious that, we need to be good users of the town's resources, and if we're not going to, as a community, take this in the proper seriousness, then we're going to have to become more draconian?
Yeah, I just want to clarify, Mark, you're suggesting NARA only, correct?
Well, no. I think what I'm suggesting is that all the playgrounds and rec facilities are closed.
Oh, yeah.
Every park except the perimeter be closed, and that the school facility, playgrounds, fields, and courts and things be closed, and that the parking spots at like rail trails and the rec facilities and conservation areas be limited to 10 or less spaces, so you would be able to control the large crowds. And then consistent with that, it would have to be conspicuously and boldly displayed that it's closed, such as physical barriers, large signs, things that attract attention, caution tape. I think maybe at NARA Park, things like, removing some of the picnic tables and other areas. People take a walk, want to sit down. Those hard surfaces are the transmissions means. That's what we have to eliminate. So, coordinating those off so we're getting better compliance. You could inadvertently just take a walk and don't think about it, sit down. But when you start seeing people going there and doing that, that's a risk that we don't want our community to be involved in.
Okay, so the governor's been pretty clear about, social distancing, 10 people or less, congregating. So I absolutely agree with Mark. If we can take measures to do a better job at educating our residents, sectioning off areas, decommissioning picnic tables, closing some parking spots, I would think that that might be the way to go now, just to allow for people to still get some fresh air to help their mental well-being. But we just need to make sure that the people aren't congregating. And we've received quite a few complaints about Narrow Park and specific in general. So not necessarily for the conservation areas or the rail trail. So I think we need to do a better job of getting that message out.
So, can I make a suggestion? I'll just, in my role as lightning rod, my suggestion would be, Cheryl, this was put on the agenda as an affirmation of the board's intent, which I think we can certainly do. I think I can poll the board in a moment, but I believe the board's position is, we absolutely have to maintain the social distancing. It's the only thing that works. If you look at the Seattle, they're finally starting to see a drop in cases. They were about 3 weeks ahead of the Northeast in terms of instituting social distancing policy. People may argue with that, maybe it was less or more, but at least there's evidence that shows social distancing works. If the virus doesn't have a host, it dies. So we need to try to encourage that through whatever means necessary. Encouragement, education, notice are all the best case. If that doesn't work, we'll have to try something else, because it's a situation where, 100 people can be fine. If you have one that's not, it endangers everyone else. So my suggestion, I'll ultimately get around to it, which is that we ask Cheryl what can do as a town, in concert with the Recreation Department and the town manager, to increase the visibility of what's required to continue to use the town facilities, such as the rail trail or the conservation trails, and what sort of activities are permitted. In other words, keeping a distance, social distance. So, and perhaps we'll probably, I believe, have another meeting this Thursday and ask if you could report back on what would be possible, and we can decide if we need to go further at that point. That's my suggestion to members of the board. Mr. Conaby, this is mostly your issue, so I'd ask, do you have a comment?
Yeah, I guess I would. Just two things. One, it's not the isolated small conservation areas, and you're trying not to say, well, one area is open, not another, everything else. And the issue is that there was significant non-compliance in a lot of situations where the distancing wasn't practiced, people were meeting up, and there was, touching of surfaces. A lot of, touching a tree is one thing, touching a, another area like a handle for a bathroom that's closed, or a picnic table. Those are the real, common areas that we're talking about. And the rail trail is an issue because it is highly used. And I think that that's what we're concerned about. People should understand the message they're saying to avoid large groups, to stay at home except for essential purposes and needs. And, you can still take a walk, you can go out in the conservation areas in your own property. That's not what we're talking about. We're talking about large groups with contacts. They can transmit the virus in those areas, and that's what we're trying to address. So I think what I'm trying to say clearly is we've had a problem, so if the problem can't be rectified, I think it's going to force some action. It's already happened in a whole bunch of other communities. You can read the reports of them where they've had to close down a lot of these areas because of that. And I think that hopefully this will, the point was to generate a discussion and input, so hopefully we can help the community and be safe. Thanks.
Thank you, Mark. So I'm going to just randomly reach out and say, Mr. Cruz, do you have comments you'd like to share?
Yeah, I generally agree with Mark on this. I think like contact between persons and surfaces is generally like should be avoided. And I think if people are congregating when they shouldn't, I totally support that. And I'm actually surprised that people are like getting that close to others with the amount of cases we've had in Massachusetts.
Okay, Mike, what do you think of the suggestion I'd sort of put forward, which is we try to drive a little more education and encourage compliance and then get a report back on Thursday?
I think that's totally fair.
Joanne, do you have a comment?
I do, yes. So I also agree with the concern of having large groups congregating and not abiding by the social distance that we've all been talking about. In driving around the other day, I was driving through Littleton, and they had, the parking lot to the playground barricaded. They had crime tape on another playground set. So I think, going forward with additional education and having it being visible would hopefully help a lot and discourage people from engaging in the undesired behavior. And I like to take walks like everybody else. We've been working from home, and I look forward to my daily walk in the woods. So I don't want to be a non-compliant person in the future. So I hope that we do not have to go to drastic measures to avoid getting in contact with others. So I agree with having, increased education, outreach. Maybe we can add something to the townwide letter that specifically addresses this. But I think just having it being visible with barricades, I like the idea of cordoning off some of the parking lots at NARA, just making it clear that we really are serious about preventing large groups from gathering.
Okay, thank you, Joanne. Dr. Taylor, you have a comment?
I think we spent enough time on this issue, given we're in the midst of a pandemic. So I have no comment.
Well, I don't know. That actually counted as a comment. Just a joke. Dr. Jacoby.
Yes, I have comments. Number one, I was out a lot over this past weekend. All of the fields and areas that I saw in town are all blocked off with yellow tape and barricades. The lower fields at the high school are all surrounded with tape. There was nobody on them. The Leary Field is locked up. You can't get in there. But I was also on the rail trail and at the Arboretum. I would be in favor at this point of leaving them open. When I was on the rail trail, there was what apparently were small family groups all walking together. When there were individuals, they were all pretty much separated from each other. And in the Arboretum, there were some smaller groups just sitting on the grass, all of them exhibiting 6 or 5 feet spacing. So, in my opinion, at least not at this time should they be closed. I'm certainly in favor of hanging up more signs, really telling people what they should or shouldn't do, and getting something in our mailing about that. But at this point, I would not suggest shutting those down.
Okay, thank you, Dr. Jacoby. Dr. Singh, do you have a comment? You can say no comment. That would be okay.
No, actually, I do have a comment. I would like that to have it more like we can have more signs. So ramping up by putting signs and barricades is fine with me because it would be better now rather than when the cases start going up.
Okay, thank you. I wasn't trying to, I just was responding to Dr. Taylor's point about we need to be mindful of the time. So that's fine. I very much appreciate your comment. If I can be so bold, I'll say it sounds like the board's consensus is closely in line with the idea of see if the town can ramp up the notification, education, and behavior modification, and that if that fails, we're going to have to take more affirmative action. So if
Quick question.
members, yes, Mark.
I think some areas like NARA, I think we definitely need to not only get the notification, but put more of the physical means in. The other question is, do you, I guess, get a sense of whether or not we feel we should be limiting the number of spaces to prevent the congregation of all these spaces at this time?
Well, my own just personal view is if we limit the number of spaces, you'll just have people parking in places that aren't spaces. Probably should be more restrictive than that. But I was hoping that Cheryl could actually talk over those options with the recreation department because they probably have a much better idea of how that will actually work. But to your point that we want to meter the number of people to therefore create greater distance between them makes perfect sense.
Okay, I think
Bill, sorry, why wouldn't we limit the parking lot at NARA to 10 at this point? I think it's pretty clear that that's what we should do.
So, Mike, I would say there's no reason not to. I'd actually be in favor of limiting it to 0, because I think if you limit it to 10, you're still going to get 12 or 15 or 20. They're just going to park somewhere other than a parking space. So, but I could be wrong. And that's why I was just suggesting that Cheryl and the recreation department might have a better handle on how best to control the parking and traffic so that we don't have create a hazard unknowingly or we don't wind up creating a hazard by blocking off parking spaces. What we want people to do is stay at home. That's the message.
Yeah, that's fair. I think we went from 1 case to 4 cases, so, the next logical progression is 16 soon, so I think either 10 or 0, I'm okay with either proposal at NARA.
Okay.
There's access from the rail trail to NARA also.
So, how to proceed? This was an item on the agenda. Mark, you had provided a draft order. I'm not sure that it requires a motion, but it probably wouldn't hurt because the agenda item was affirmation of the closure of the fields, and I think that's certainly at some level what we wish to do is affirm that is the board's direction. And you're always very good at crafting motions, so would you mind?
no, I wouldn't. We can change the whole. I wrote the order and with the secondary provisions to Cheryl, and it's essentially the same top section of the whereas clause is basically establishing, and then the authority and order. And I think the first one, orders all playgrounds and recreational facilities are closed, and residents should not congregate at these locations. It seems like it's already been ordered and it's pretty consistent. I think the other ones, I think NARA Park was ordered closed. I guess I would just be explicit and say, except for the perimeter designated walking path where residents must observe social distance requirements and residents should not congregate at this location. I think that's pretty consistent. And then the other one would be the ordering of all parking areas at the trails, recreational and conservation areas be limited And I guess I was thinking 10 because it's 10 residents, but we can work on that. And then you must observe social distancing and then to congregate. Well, I think those are kind of the points. So, being consistent with what you said, we could act on it tonight. We could wait until Thursday. Those are different options because we don't have to make the decision tonight. But as Mike says, as we see this exponential growth, we start seeing good weather. And there was a huge problem at NARA. I'm thinking that sooner than later would be a good thing, and it would provide clear guidance to the town.
So may I suggest then maybe your motion would be something along the lines of the board affirms the, as you say, the closure of public facilities, maintaining social distance and, proper community behavior, and with a report back to the board in the next specially scheduled Board of Health meeting.
You said public facilities. I guess we have the public buildings closure, which I think is the next item. I think that ought to be separate. So I think,
Agreed.
okay, I think so I guess really you're affirming the playgrounds, recreational facility, near a park, except for the walking path, and parking be limited, and then that's the directive, and then we're going to vote on it at the next meeting. Is that what you're suggesting?
It is. So do you motion in that for that action?
That's fine. As long as it's on the agenda for the next meeting as well, so we can monitor and keep track of it.
Very good. Is there a second?
Bill, I'll second it, but can we get comments from the public?
Yes, but Mike, I'll just tell you it was, thank you, that's a very good point. I wanted there to be an actual motion before we took public comment, because otherwise it would not be clear what it was that people were commenting on. So.
Understood.
So thank you for your second. So with the motion made and seconded, I'll ask, is there comments from members of the board first? Public will go second.
So this is just a comment. So there will be a different motion drafted for us to review for the next meeting than what was provided with this meeting.
So Joanne, I believe the intent is that we'll get a report from the health department at the next meeting as to whether or not measures have been effective, or what additional measures the town was able to provide to try to encourage the social distancing. And then at that point, the board can either choose to implement different measures than the ones we have currently, or we can choose to continue with the ones that are in effect. But yes, there would be an opportunity to take action at the next meeting.
All right, thanks.
Okay, at this point, then I'll ask, are there comments from members of the public?
May I make a comment, Bill?
Yes, please, go ahead.
So, I'm in favor of this motion to do what you said, and then take further get a report from the health department. I do want to kind of ask a question, and maybe there's some things that I haven't seen. It sounds like there were problems of congregating at NARA. I just asking about that, and just wanted to clarify that because I have not seen that on the trails, similar to what Dr. Jacoby said. I've seen family groups going around in the trails separate from other groups, and when they had to cross on the trails, everybody practiced proper social distancing. If there was any conversation, it was often from 10 feet apart. Of course, there's nothing to touch on the trails except a stick or a tree or something, and so I think the trails are really not, the conservation lands basically are not a problem. Their parking areas for the most part are not large enough to hold more than 10 vehicles. I'm trying to think of exceptions, but I can't think of one. And I know that the rail trails are also used by families bike riding, also separate from other families. And so what I'm trying to say is I haven't seen any problems on the trails or the either bike trails or conservation land trails. And so I would hope that we would not restrict those unless there were problems there. And again, I haven't seen the problem at Aram. I haven't been to there to see the problem. Thank you.
Okay, thank you, Dave. So back to, do we have, Matt, can you tell, is there anyone from the public wishing to make a comment?
Yep, we have 6 on the list.
Okay, then I'll just ask, please, given the hour, and so whether you could try to bring your comments forward, say succinctly. Thank you.
All right. First caller is live.
Hello? Hello, can you hear me?
Yes, we can.
I'm Greg Bishop from Main Street. Couple of points. First of all, from Governor Baker's order, he actually says that the order does not prohibit gatherings of more than 10 people in an unenclosed outdoor space, such as a park, athletic field, or parking lot. And this is the outdoors, where you have ventilation. I've done a lot of study in this. I haven't read anywhere that this is considered to be transmitted in the air. It's sneezes and coughs, sort of things. So outdoors is good. There's also a thing you should consider that's good, which is the ultraviolet light from the sun is very lethal to this virus. So tables that are out in the light all the time do get cleaned, but I think you could go a long way with posting, educating people that they really ought not to touch doorknobs and things like that, because they might easily get something that way. That might be discouraging. So you really, and I want to agree with the people that talked about the trails and so on. And one thing that I think why this was positively in Governor Baker's order is that there is a real public health advantage for the mental health of the community in terms of exercise, stress reduction, air and sunshine. I think it's very important to factor in how to enhance this. And I agree with the comment that if you restrict the parking, you're going to squeeze people in more. If you have a parking lot that holds 25 cars and 10 parked there, they're naturally not going to group up. So, and we have a lot of people at home. People go a little nuts sometimes. It's really good to get them out there and get them educated. And as a matter of fact, you could probably recruit some people out there to stand there and do a little educating with their friends from a safe distance. So I really am opposed to control first and think about it later. I'm very much in favor of educating and positively influencing people before you have to turn our town into a walled city.
Well, thank you, Mr. Bishop. Next call, please.
Next caller is live.
Tara from West Acton, and I agree with what Dave Martin said and with Mr. Bishop, and I feel like the trails should not be closed, and I feel like that if you close or reduce the narrow parking, what you're saying is that only privileged people who happen to live near it can go there, and the people who don't have access, in fact, that's one of the reasons why I've asked the Open Space Committee to make sure that all the apartment buildings get access to these wonderful conservation trails. So I hope that you do not vote to close the trails. And actually, I'm going to ask a question. Is this vote to enact the order that you have drafted, or is this to put it off and just close certain areas? And I'm not really sure what the vote is, or what the motion is.
So the motion...
That's a question.
Yes, I understand that. The motion, as I heard it, is that we're affirming the board's previous direction that the facilities that Mark read the list of them are to be closed, and we're directing that the health department work with the recreation and the town manager to improve the notification and the proper use of the facilities during this health emergency, and give us a report on the effectiveness of those measures.
Okay, thank you. So you're not voting to put this order in place, which says that the trails would be closed? the motion is to vote on what you just said.
Yes.
Is that correct?
Yes.
Okay. Then I'm in favor of that, and I also love the idea of recruiting people. I don't know if anybody read the article from the Globe that in West Africa with the Ebola, that when they just did enforcement and signs, that it wasn't as useful as when neighbors were telling people, hey, you guys, this is really important, and then people, that message spreads a lot faster, and so I would certainly be happy to stand outside and talk to people in a safe distance. Thank you.
Okay, thank you, Tara. Next caller, is there one, Matt?
Next caller, your wife. Hi, I'm Steve Long from West Acton. Thank you all for volunteering and keeping the town safe. And I initially had a clarifying question, which I think has been answered. It sounds like the order as drafted will be modified to remove the prohibition on the ban on going on conservation lands. So it sounds like the conservation lands are proposed to be open.
Yes, I would just point out that that's, to be fair, that's conditioned on the fact that we see better use of the land. And
terrific.
Hopefully that will be the case.
That's great. I was just going to offer up some resources. There's an organization called the Outdoor Alliance. There's another called the American Hiking Association. They've created public education materials and guidance for safe hiking during the time of this pandemic. Also, in my professional life, I work with a global conservation organization, and we've been working very closely with the Commonwealth and other conservation organizations on guidelines for safe use of public and private conservation lands, so I could reflect on some of the conversations happening at the state level. And if you are considering a ban on the conservation lands, I'd suggest a nuanced approach with an exemption for small groups from the same household, and also an exemption for stewardship activities, especially now since garlic mustard removal is in high season. So again, thanks. I guess I could just direct the materials I have to the Board of Health website or email address unless you tell me otherwise. Thank you for your time.
No, that would be fine. Very good. Thank you, Mr. Long. Matt, anyone else?
Two more. Next caller, your wife.
Hi, I'll be very quick. Miriam Lezak in South. Oh, that was very quick. I just, basically pretty much what everyone else says about making sure that conservation land is open. And what I've seen when I've been out walking is that people are invariably polite about, keeping their distance. And I see kids out and, people with dogs and small children, and both of those need to be out and aired and run around. So it's kind of vital, I think, for the mental health of the community to keep things open. And also, as I said, it's just people have been very cognizant of other people's space is what I've seen. Thank you. That's it.
Okay, thank you very much. Matt, there's no one else looking to speak?
There's one more.
Please go ahead. Yeah, I saw a note from Mr. Davidson. He said he's withdrawn his request to speak, so perhaps that was it.
I can see the caller is still on there, but they have not unmuted their mic. So maybe they've stepped away from their device.
Okay, well, it appears then we've reached the end of public comment. We have a motion that's been made and seconded. I'll ask you, given the public comment, do members have anything they wish to add or change or modify? If not, we'll take a vote. This would be the opportunity.
No, I just had to follow up on my question. We did have, Mark talked about some reports of problems at NARA. Have we heard about gatherings of people inappropriately on either the conservation lands or the rail trails, or we just did we just lump those in with NARA?
Bill, we can answer that. There were, and I did observe it both at NARA and on the rail trail, and a whole bunch of pictures were sent to the department for distribution that showed some of those things, the amount of people at NARA, the people congregating on the picnic area and acting in groups in the fields. So that was what directed the attention and was suggested about it. And I think one of the things that I guess I wanted to end with is, which really goes, I think what Bill Taylor was saying, what is the guideline? What does stay at home mean from the public health advisory from DPH and the governor's order? It means only leave your home to address essential needs and to get fresh air and exercise. Avoid unnecessary contact with all other individuals. That's the specific directive that we're supposed to be following. So I think the point is, it's not being observed, so try to educate. This certainly is helping, generate the attention, which is exactly what was meant to do in the discussion, to provide the notice, and then to affirm the policy, and then monitor it and take stepwise action as required to implement.
Okay, thank you, Mark. And Dave, I'll just offer, I mean, yes, there has, as Mark just said, there has been evidence of, some undesirable behavior. And the problem is that, 90% of the time it can be perfectly acceptable. It's the 10% when it isn't that causes the propagation of the health emergency that we have. And that's why it's one of those situations where most is not good enough. It has to be almost all to really be effective. So that's what we're trying to achieve. But
Sure. I know. I completely understand. I'm completely supportive. It just sounds like there's a very different situation at the conservation lands than NARA and maybe the field. But okay, thank you. I got my question answered.
Okay, thank you very much. So other members of the board, if there's no comment, I'd like to call a vote. Start with Mr. Economy.
Aye.
I happen to see Dr. Taylor's face. Dr. Taylor?
I'll vote aye.
Mr. Cruz?
Aye.
Ms. Becerra?
Aye.
Very good. I also vote aye. Consequently, it's a unanimous opinion. Thank you. We can next move on to the next agenda item, which I believe was the public buildings. Is that correct, Cheryl?
It is. The next agenda is the extension of the public buildings closure.
Okay, would you mind just giving us a brief rundown? I believe I know what that is, but it would be helpful if you would just cover what specifically we're being asked for.
So we're looking for a vote of the board to put either indefinite or in concurrent with the public local public emergency, or a specific date of keeping the buildings closed. I did just receive word that the governor is going to be updating his date tomorrow.
Okay, thank you. So could I ask, does the department have a recommendation? I mean, if not, mine would be that it be run concurrently with the state's declaration of an emergency.
That would be my recommendation as well.
Okay. Discussion by members of the board?
I would suggest we don't take a lot of time to deal with it. Would make the motion to do that.
Very good. Thank you, Mr. Conaby. Is there a second?
Second.
Thank you, Mr. Cruz. Motion made and seconded. Further discussion? Hearing none, then I'll call again the roll to vote. I'll go backwards this time. Ms. Becerra?
Aye.
Mr. Cruz?
Aye.
Mr. Conaby?
Aye.
Dr. Taylor?
Aye.
And I vote aye as well. Very good. Motion passes unanimously. Cheryl, I apologize. I don't have the agenda in front of me. What is our next item?
So the next agenda item is the approval of the town-wide mailing letter. Do you want me to put that up on the screen?
That would be good. Thank you. And Dr. Taylor, this was your initiative. I think
Bill, I can't hear you.
think we may have lost him. Hold on a second. Oh, no, he muted himself.
I'm unmuted.
No, I was unmuting myself, but for whatever reason, it didn't want to unmute me. I had to really bang on the computer. Okay, I was saying, Dr. Taylor, I believe this was your initiative. I think there's been some edits made, and I just wonder if you would talk about where you think we are in this process. Are we good to go, or we need further edits? What would be your recommendation?
Well, I think we're ready to go. This was first discussed earlier, and in terms of a pandemic, a week is a lot of time. So let me explain a couple things that have changed. CDC has now changed the definition of a suspect case during a pandemic. So the nursing service in their follow-up and through the letter will be asking, if you have fever and cough, you need to contact the nursing service as well as your doctor. And, a lot of these discussions are about trying to confine people and avoid things. The biggest risk is walking by someone who's ill. Whether it's indoors, that's worse, or outdoors. The purpose of the letter, which is going out to all households in the town, is to ask them if you have fever and cough, and then providing information on what you need to do. And if you're well, based on the guidelines through the Department of Public Health and the governor's emergency actions, what you need to do. And that really hasn't changed. I think the letter provides a lot of information. You may not be aware, but those cases that are positive are home quarantined. They are not allowed to leave the house. And there'll be follow-up contact to see if they need any assistance in getting groceries and medications, because they are at risk. Home isolation also means household members are at high risk, living with someone who is a case. So separation has to occur within the house and maintaining distancing within. So home isolation is one thing if you're ill, but if you have no symptoms, there's a whole list in this letter of what you can do, but to be careful and to be safe. It ends up with 3 sources of reliable information, and I encourage you to read broadly about this. The first is the local website, actonma.gov/COVID-19. The second is the state, mass.gov, and then select coronavirus update, and it will bring you up to date. And then finally, at the national level, cdc.gov. And I think as you read through these things, you'll have a different perspective than what I want to do versus the community. What individuals don't really want to do is infect someone else. The people at highest risk are those 70 and older. So those in particular are at risk and have higher rates of hospitalization, of intensive care admissions, and fatality. So I think it's ready to go. I must say, I have worked a lot with Cheryl on this. She's been an excellent Confederate in that. And I do want to acknowledge how well she's done moving things forward without getting hit by moving parts. So I want to compliment her on that. I've also worked with Heather. They're going to be doing a lot of work on the follow-up. We invite people to learn more about it. And if you're ill, the town wants to reach out, identify you, and provide support.
Great. Well, thank you, Dr. Bill. So, and thank you. Also, I would amplify what you say with as far as Cheryl and Heather go. They're amazing resources in this rather stressful time. I would just point out to the board that we previously, at a previous meeting, approved sending this letter to the town under the board's name. So I don't believe we need to do that. Approve it again. I would just say I'm reading through it. It looks pretty good to me. I'd ask at this time if other members of the board have comments that we'd like to share with.
I would make one comment. This has been reviewed by Cheryl, earlier by the board. Heather has seen this. I've sent it to the town manager. I have made it incorporating a lot of those comments. So I think it's been well reviewed. It's formatted in a manner that it tells you what your needs are and then gives you the information that you need to meet those needs.
Okay. Well, thank you. So again, my assumption would be that this is ready to go, but if we offer an opportunity for board members and Mr. Martin to comment if anyone wishes to.
I just have a very brief comment.
Yes, please go ahead.
Okay, I think the letter is great. Fully supportive of the letter. I think the letter should be mirrored on a web page, link from the COVID-19 web page, or actually is the COVID-19 web page, with a translation service, right? It's easy to hook these up with a translation service, so even without going to get someone else, someone can translate it to Chinese or Russian or Portuguese, so or whatever one we want to put into it. And so all I'm suggesting is that this letter be online as well, and it be auto-translated.
Okay, very good. Thank you. I don't think you'll find any disagreement from members of the board.
No, that sounds good.
All right. So again, any members of the board wish to comment on the letter?
I guess, Bill,
I just,
let Joanne go first.
okay, I'll be quick. No, I just want to thank Bill and Cheryl and Heather on putting this together. I think it's a great letter and a great initiative. So I want to thank you all for working on it.
Thank you.
Again, I appreciate it. I really thank you very much, Bill. I guess I have three comments. One, kind of in line with the CDC and the state directive about it. If you have symptoms, they say, should it remain in the home and request assistance with assessing essential services? I don't know if you want to add that or you considered that.
Well, the issue was the difference between home isolation and stay-at-home recommendations is you can go out to the grocery store, go out for medications, you can go out for mental health.
Yeah.
But in the situation where we don't have adequate testing, we can't test everyone who's ill. And so what we need to do is when they have the definition of fever and cough during a pandemic of coronavirus, that has to be assumed as a possible case in terms of isolation.
Yeah, I guess I just...
No, but before I finish, there are criteria that when you can be released from home isolation. One of them happens to be if you get a test and it's negative, you can be released from home isolation. The other three things are more symptom-based. So if you have no fever for 72 hours and your symptoms have improved and at least 7 days have passed since your symptoms started, you're no longer in need to be isolated. So it's not as long as it used to be of 14 days now.
Right. I guess what I'm saying is you have the guidance for home quarantine, but there's nothing on isolation. So basically, if you have any signs or symptoms, you should isolate, should remain in the home. I guess that was the point that I was trying to make. And that's what the CDC recommendations are. I'm just thinking, just one more thing, and that follows up to the New York 10-point plan saying sick individuals should not leave their home unless to receive medical care, and only after a telehealth visit determine if leaving the home is in the best interest of their health. So again, that's part of the isolation segment. I didn't see that in this, and I didn't know whether that was deliberate or not. But with already a handful of cases, I thought it was something we may want to add.
Well, you know, physician practice in Acton and Concord and surrounding towns, I have no idea how many are equipped to do telemedicine visits. I don't know how many patients would be interested in doing that. So I think that could be a restriction. I mean, it's pretty clear they need to let their primary care physician know they have these symptoms and they're being recommended to be in home isolation. Home isolation, I haven't used the word quarantine. Quarantine goes back to the 14th century in Italy, when the ships with illness on board had to stay offshore for 40 days. And that led to the word quarantine. So we have two: home isolation, which means you can't go out to get your groceries. You can go out to see your doctor if you notify them before you come. And you may need help with groceries, and that's where, if the person can work that out with friends and family, that's one way. But by identifying with Acton Nursing, we can provide some community service and make sure that people, can maintain their stock of food and prescriptions. And I think it's particularly of concern with people that are older and who live alone, and how we can provide service to them.
Mark, I can see your.
I said, I think the point of keep adding something about isolation in the letter is just all I was pointing out. I missed it. And then last but not least, I think we should also try to distribute this, because the time is essential, through some of the electronic means, if possible, some of the mailing, email list and things of a lot of the organizations in town.
Okay. Now, home isolation is defined on point number 3. After you contact your physician and call the nursing service, it talks about home isolation as described by CDC and when you can be released. That's on page 2.
It says follow home quarantine, not isolation.
You may be looking at an earlier version that was part of the minutes.
Yeah, I was looking at the one that was sent with the packet. That's why, Bill.
Yeah, this is a glossier version with the logo and the format. So the home isolation is in there. And page 3, if you have no symptoms, you can follow the Department of Public Health's advisory to stay at home. And it goes into details. And then last, it presents the information sources, and I would go there first. Don't just read a story in the paper and then tell your friends about it.
Yeah. Obviously, consult the experts and your physician. But thank you very much.
You're welcome.
So I have one very trivial comment, which is up at the very front in the letter. It says, if I can read Spanish, it says, "This is an important notice. Please have it translated." And I assume it repeats that in the other languages, but the one language that's missing is English. And people might wonder what it is that is being said. So when I've seen this, I've usually seen it also in English. But that's a very minor point. Other members of the board comments, or are we all good to go?
Yeah, I just had one suggestion, Bill. I found a website here today, which is BUOY health.com, Massachusetts. It's got a very sophisticated, I think, diagnostic wire diagram. If you say yes on one, it takes you to a page. If you say no, and it even deals with secondary symptoms, and at the end it gives you a suspected diagnosis. So just look at it and see if you think it's worthwhile.
Yeah, I have looked at that, Tom.
Yeah. Have you?
And, go ahead.
No.
The reason I didn't put it in, actually, the town manager suggested that as a possibility. There's also a symptom checker on the CDC site. You know, both of these are hooked into report. And the one with Boy Health reports to the primary care center at Harvard University. So I don't want people reporting out of town, first of all. And we'll have a more standard definition. We'll have follow-up services to those individuals. These are AI programs that can have a lot of helpfulness to track things and look at trends. But I think what we want to know, you know, we have 4 cases. That's not a lot of cases in a population of 24,000. But in the US, there's community transmission of coronavirus. We want to identify those that are ill and put them at home so they can be monitored. It can take, in this illness, which could last as much as a week, a little bit over a week, 80% of people will recover on their own at home. The problem is 20% may have complications and require hospitalizations, even 9 to 12 days after they first started their symptoms. And that's a service that we can provide through the nursing service, through the follow-up, to identify those 20%.
Okay, thank you, doctors. At this point, Matt, can I ask, are there any members of the public who wish to comment?
We have 2 waiting to speak.
Okay, please put them on.
Hi, Kara, and I'm just going to say thank you so much. This is a great letter. I do urge you, though, to add something to the front that says, hey, you guys, this is an emergency, because it sort of says you're at risk if you catch it, but guess what? You could be spreading it to everybody in your neighborhood and your family. It's sort of an emergency in the sense that it's a pandemic, and it doesn't say that right up front. And otherwise, I think it's a wonderful letter. Thank you so much.
Okay, thank you. Next caller.
Next caller, you're live.
Hi, folks. I'm looking for clarification. So last week, your vote on this letter, I thought you were aiming for 3,000 letters. I thought you were targeting 70-year-olds and above. If I heard earlier, I think Dr. Taylor mentioned this was targeted now for the whole town. So is there a change from last week in that respect?
So I'll answer that. The number, by the way, pardon me, would you mind identifying yourself?
Dave Lunger.
Oh, thank you. So I think the 3,000 was actually my mistake. At one point during the meeting, I said I thought there was 3,000 households in Acton, and Cheryl corrected me. There's 8,000 households in Acton. So that may have been where the number came from.
There was also talk of 70-year-olds and it being a first wave.
Yes, let me explain. Initially, 70-year-olds and older was a CDC recommendation, as well as the DPH advisory. And the DPH advisory, those that are 70 and over are more vulnerable because of complicating medical conditions that are more common in that age group. The reason it changed, the town manager wanted to reach the entire population. And one of the things we're planning, but it doesn't violate the fact that if you're 70 and older, you have more risk. And I think in an earlier presentation, that age group makes up 1/3 of all the cases. They also make up 45% of hospitalizations, and they make up 75% of admissions to the intensive care unit. So that message is still there. But one of the things, by going broadly in the population, we'll identify younger cases, and their household members are at very high risk. A 30% risk of contracting coronavirus from a household exposure. In China, 80% of the cases occurred in household transmission. So this allows us to identify people who are ill, and we'll also ask if household members are ill. And if so,
So the answer to my question then is there's only going to be one wave, and it's to the entire town.
that's correct.
Okay. Thank you.
All right, well, thank you. As I mentioned before, I believe the board's already voted in support of this, so if there's no further comments from members of the board, I think we move to the next agenda item.
So I was looking for some clarification for the community gardens. I brought this up at the last meeting. You know, it's not a brick and mortar facility that the governor's regulated. And there is guidance in the essential list that says if farm workers who field crops. So it's a little bit, you know, broad, but I do believe because it's outside that it's something that does not fall in the governor's order, but I just wanted some clarification from the board.
There we go. I seem to sometimes have trouble unmuting. Okay, very good. We'll certainly poll the members. I'll just offer, to me, this seems like a reasonable activity. You know, we need to provide perhaps reminders for good social pandemic behavior, namely stay 6 feet away. You know, if you need to wash your hands, please wash your hands. Perhaps better would be to wear garden gloves. But as you say, Cheryl, this is outdoors. It tends to be a somewhat solitary activity. Seems like there should be a way, we should be able to find a path to allow that to continue and still maintain good public health practice. Can I ask comments from members of the board? Okay. I don't hear any, Cheryl, so sounds like we
That
can
was easy.
move forward.
Okay. The next item on the agenda is the minutes. We have two sets from the 19th and the 26th.
All right, very good. I'll just offer, I did take the time to read them. I have no comments on either set. Any other members have comments? Let's take up the minutes for March 19th first. Are there any comments from members?
Bill, on the vote for the building closure, wasn't there a date on that, as I recall? Because it's not listed in the minutes.
So, Mark, I'm sorry, when you say date, meaning date of effect or date of termination?
Both.
Oh, okay. I don't remember. Actually, you made the motion, right? So you would probably have a much better memory.
I could check my notes, but I did not see a date in my minutes. In my notes, I mean.
I thought it was based on what the selectmen had, so maybe just clarify that.
I can go back and check that.
So could I just ask, Mark, I believe I know which one you're referring to, but is that on the minutes for the 19th? Or is that in the minutes for the 26th?
I was looking at the minutes of the 19th.
Yeah.
Regular business A1, closure of town buildings.
Yes, it's number one. Exactly.
Oh, I'm sorry. So I'm thinking of construction activities. Yeah, I guess my memory is that was to run concurrently with the declaration of emergency, but
That's what we just voted. I thought there was a date, but I just want to be just clear on that. I just can't recall.
I think that's the reason why I was looking for another vote on that tonight.
yeah, we may have omitted. We may have failed to include a date. Or we may have said that it expires on April 6th, which is when that emergency at the time was due to expire. But I guess we clarified it with our action tonight anyway.
Yeah, we did. I think we probably were basing it on what town manager is. That's what I recall, but maybe other folks can enlighten me.
I don't know, Mark. I mean, I don't have any distinct memory one way or the other.
So I think the selectmen voted that until further notice. We considered going as long as the state of emergency, but I believe we voted it until further notice.
Okay.
And which meant that it would require another vote by both boards.
So my suggestion, though, since memory is not concrete, for the purposes of the minutes, it might be best to not guess. If we don't know, we should just leave it as is, which doesn't include a date, unless people are certain of their memory.
Yeah, that's fine. In which case, you would you might want to at your next meeting just affirm a date put it on the agenda for your next meeting and affirm a date. Actually, your vote, I believe, is more important than the Board of Selectmen's vote.
Yeah, so Dave, I think actually we did that tonight. One of the agenda items was to continue the closure of the public buildings, which we did.
Oh, okay. That doesn't have an end date either.
Well, the motion that was made tonight was that it would run concurrently with the state's declaration of emergency.
Okay, great, thank you.
Okay, if there are no other comments on the minutes, would anyone care to motion or make corrections?
So moved.
Thank you, Mike. And Joanne, is that a second? Yeah, very good. So just so we're clear, is this to have the minutes as presented or with corrections?
With corrections, of course.
Okay, very good. Motion made and seconded to approve the minutes with corrections of March 19. All those in favor, please say aye. Aye.
Aye.
Aye.
Okay, and I think we're missing, who are we missing? Mr. Conaby.
Aye.
Excellent, thank you. I also vote aye. So the minutes are approved unanimously. That brings us to the minutes of March 26. Members have any comments? I have none. Dr. Taylor, I see you unmuted. Does that mean you have a comment?
No comment. I make a motion for approval.
I guess I would
Very good.
say that the part of the minutes on the construction is not exactly what was my recollection of what the motion was. So I guess that was a question.
Okay.
Reading it from the information was sent to Cheryl. And I think two things were deferring and postponing the inspections and recognizing the construction activities shall follow the guidelines of the land use department. Those were two of the things in the motion.
Yes, I believe you're correct, but those are in the minutes, right? Are you saying that the other things in the minutes are extraneous, or?
No.
Bill, didn't we have something about porta potties at that meeting?
We certainly had something about closing porta potties. I think it was the previous meeting, but I don't remember. Cheryl, would you happen to remember when we talked about porta potties?
I'm pretty sure I might have missed it on the 19th, but I will check that.
Well, fortunately, these meetings are recorded, so we can actually.
Yeah,
what we say.
exactly.
Yeah. You're having trouble sleeping, you can go back and review the minutes. Okay, so let me just, for procedure, Dr. Taylor has made a motion to accept the minutes. And Mr. Conaby was suggesting corrections, I believe.
I guess I didn't follow. If Cheryl cut and pasted them, they're accurate, then it'd be fine. We'll just say with corrections if required, just from the cut and paste, but otherwise second.
Okay, very good. Motion made and seconded to accept the minutes with corrections as necessary. I'll ask if there's further comments or discussion. Hearing none, all those in favor, please say aye.
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 Someone's missing. Who's missing? I heard Joanne, I heard Mike, I heard Dr. Bill. Did you say aye?
Yes, I did.
Excellent. Okay, I think we have everyone. I'm also aye. Motion passes unanimously. Thank you. Cheryl, do we have any other items of business?
No, so the items that I discussed that I need clarification on at the beginning of the meeting, do you want me to just schedule those for an agenda item for Thursday?
Would you mind reviewing what those are again?
The construction order, the one that we were just discussing actually in the minutes, you know, it can read both ways, as in a recommendation or a policy, and then it can also read as an order. And so I was seeking clarification on which one it was. I mean, I tend to read it more as a policy, but the title of the document says policy order. So I just need a clarification.
So Mark, I think that was your motion, wasn't it?
Very hard to get to the button. Yeah, I think the order was to postpone or defer the inspections and to, but there were certain other things that were not, you know, I think that are policy, you know, strongly recommended to limit the activities. That's certainly not an order. And then the order, I think, also is that all of the construction activities have to be consistent with the state guidelines and procedures listed. And the order is, if any of them are not followed, they must close the site. So I guess that's why I'm saying it's a combination. It is an order to postpone or defer inspections. It's a policy to limit them. It's a policy. It's an order to be consistent with the state. So I guess the answer is, it depends which section it is, whether it's policy or order.
I think I'm specifically talking about, like, you know, the town conducting the inspections. You know, like you said, you know, we are currently limiting our inspections, and I think Frank Ramsbottom spoke about that at the last meeting. You know, we're trying to keep them safe by doing vacant buildings and outside inspections. So I just want to make sure that that's something that can still be done at this point, because I just need to make sure it's not an order for us to postpone or defer the inspections versus just a recommendation.
Well, I think my understanding was it is to, in order to defer or postpone non-emergency inspections based on limited staff. You know, that doesn't mean, you know, how much you postpone them or defer them is up to the department. But you're not saying you can't do them, but you are saying that you're not. Okay. It is an order for what the town should do, prioritize activities within the state of emergency.
So I think I'll just offer then, Cheryl, yes, you should probably put it on the agenda. Sounds like the board just needs to restate what its majority opinion is. There's still, rather than try to debate what our recollection of what we think we voted on is, we should just bring it up for discussion again and take a vote.
Okay.
And then was there anything else besides that?
You know, it's late and I'm going back to my, what I talked about, but not that I can remember, but I thought there was. So I'll have to, I'll just put that on the agenda as well for next, for Thursday.
All right, that'd be great. And so we are in the meeting this Thursday. And
Cheryl, I think it was the daily update you wanted to ask about.
Oh yeah, right. That's right. Thank you, Dr. Bell. You know how we were saying that we typically put out, or John typically puts out a daily update on the website where we're posting the amount of confirmed cases that we have, and we just wanted board guidance that still we should still continue with that message.
that sounds reasonable to me, but let me poll the members. Dr. Bill, what do you think?
Yeah, I think it's important to share that information with the community.
Mr. Conomy?
If staff allows, yes.
Dr. Jacoby? You have to unmute, Tom.
Yes, I agree. I agree with Cheryl said.
Okay. Just randomly, Dr. Singh?
Yes, I agree with Cheryl.
And Ms. Becerra?
I agree as well.
And Mike?
Yes, full transparency.
Okay. So I think that covers it. I apologize for the frequency of the meetings. Cheryl, if you haven't posted us for next Monday, probably should. Keep to our Monday, Thursday cadence. I'm hoping that soon we'll be able to start canceling meetings that are unneeded, but it appears that we still have issues coming up on a fairly frequent basis. So that, I think we've concluded tonight's business. That would require a motion to adjourn from someone.
So moved.
Thank you, Ms. Becerra. Is there a second?
Second.
How did I know it would be you, Mike? Excellent. Motion made and seconded to adjourn. All those in favor, please say aye. Aye. Aye.
Aye.
Aye.
Aye. Meeting adjourned. Thank you very much, everyone. Stay healthy. And we'll talk to you soon.
Thanks, Bill.
Thank you.
Thank you.